Hi, I am Dr. Ahmed Hussain Pathan, Consultant General and Laparoscopic Surgeon. Today I am going to tell you about the appendicitis. Appendicitis is an inflammation of the appendix. Appendix, it is a tubular structure which is attached at the base of the cecum. When there is an infection occurs and it is causing the appendicitis. When the patient having complaint of appendicitis presents with the pain in the right iliac fossa, or we call it as a pain in the right lower abdomen. Pain in the right lower abdomen doesn't indicate it is only causes because of the appendicitis. There are certain other causes which can cause pain in the right iliac fossa. So we have to confirm the diagnosis. Other causes including the ureteric colic, in females torsion of the right ovary, and also inflammation of the cecum. So on the basis of lab investigations and radiological investigations, including ultrasound and an abdomen, we confirm the diagnosis and manage it accordingly. Once the diagnosis of the appendicitis is confirmed, then we have to follow the Alvarado score. In Alvarado score, it indicates or it tells about the severity of the appendicitis. Either it is a mild, it is a moderate, or it is a severe. Mild to moderate can be treated conservatively, and moderate to severe can be go with the surgery. In the conservative management, we give the IV fluids, antibiotics, soft diet, painkillers, antiemetics, and other symptomatic drugs. But if there is a fecalith, which is a stony material of the feces impacted in the lumen of the appendix, then we will have to go straight away with the surgery. Other thing is that if there is a appendicular lump. Appendicular lump occurs when there is an inflammation in the appendix and the omentum, which is a policeman of the abdomen, attached with the appendix and the terminal part of the ileum, a small bowel, adder, and they form a lump. And then for the lump we have to start with the examination, investigations, and then we proceed with the management. We mark the abdominal lump on the abdomen and we start antibiotics, IV fluids, antiemetics, and the painkillers. That is called as the Ochsner-Schreiner's regime, in which we observe the appendicular lump. If it resolves, then we call the patient after 4 to 6 weeks for the elective appendectomy to prevent the secondary or recurrent appendicitis. If it doesn't resolve, then we can proceed with the surgery. Surgery of the appendix, it depends upon how we proceed. There are two methods of the appendicular surgery. One is the minimal invasive surgery, or we can call it as a keyhole surgery, in which we place 3 ports, 5 mm ports and one 10 mm port, through which we insert the camera, we identify the appendix, and then we can cut and take out the appendix out from the abdomen. If there is a lump, or the appendicular surgery cannot be completed with the minimal invasive surgery, and we do the open laparotomy or with the appendicular grid iron incision, and we take out the appendix.